Oh, there'll be consequences for you, you dangerous medics, you dangerous nurses, you dangerous healthcare workers. There'll be consequences, but not till April.
Well, how do you feel about losing your job?
Devastated again. I think that it's absolutely ludicrous that we are firing people that have run the service from the very beginning of the pandemic. We've all attended. I left maternity leave early to help the healthcare system and provide care. At that point, we had no idea what the virus was about. We had no PPE. We just mucked in and we looked after people as best that we could. And to reward those people now by saying, we actually are going to go against your principles and ask you to choose between your health, your principles and your job is absolutely ludicrous. It's against our code. It's against the law. You cannot coerce and force somebody into a medical treatment. I would never do it as a practitioner, and I don't understand why the government feel it's okay to do it now.
All right, thank you both.
Thank you.
It's against the code, Philippa.
No one's forcing them to have it. There's just a consequence of the
It's
choice
an enormous
of
consequence.
not having it. But the right to bodily autonomy still holds true.
Thank you, thank you.
I'm getting tired of watching videos of medics who are incredibly brave going on television to talk about the fact that they don't want to be vaccinated with the COVID jab because right now they don't feel old enough to have it and they feel they've already been exposed to the virus. To then have medics basically question their integrity and status because of the fact that they're choosing not to have the vaccine, and even bring in the idea that if they choose not to, well, there will be consequences they need to accept. No, that's not okay. It's not okay that doctors, nurses, healthcare professionals and care workers who spent their entire time on the front line working to save individuals who did get unfortunately very, very sick and at times die from this disease, they gave their time, they put their lives at risk when nobody knew how serious this could affect them. And everyone was fine with that. They were heroes then. But now, now they're trying to kind of make everyone have a jab. And these professionals who actually work in science, medicine and care, who are choosing not to have it based in their understanding of where they are physically, mentally, and also age-wise, they're choosing a different path because they have a right to do that. Firstly, that's exactly what medicine should be, about personal choice. But suddenly it's acceptable to sack them, but not till April. Oh, there'll be consequences for you, you dangerous medics, you dangerous nurses, you dangerous healthcare workers. There'll be consequences. You're going to lose your job in April when we've got through winter, because until then we're going to really need you. And then maybe a bit later because we might struggle. But, you know, at some point when we've decided that we can manage this situation without you, which we can't right now, we're going to really, really need you, well, then you're going to lose your job. And until then, we're going to spend time piously suggesting that you aren't the heroes that we all clapped for initially. Because it works, doesn't it? One way or another. They're either heroes or they're not. And in my opinion, I'd rather stick with the fact that those medical practitioners, they were all very, very heroic in those early days and early stages. Now they have the information they've got, they're opting out of the vaccine, and everyone should support them, especially their bloody colleagues.